Your skin is like a mirror to your health. It tells a story about what's going on inside your body, even when you feel completely fine. And when it comes to diabetes, a condition that quietly develops over years, your skin might be screaming warnings you don't even realize are there. While most people associate diabetes with excessive thirst, frequent urination, or constant fatigue, some of the earliest warning signs are written right on your skin, often months or even years before other symptoms appear. The scary part? Let's start with one of the most common but misunderstood signs: acanthosis nigricans. This condition shows up as dark, velvety patches of skin that often appear around your neck, armpits, groin, or even your elbows and knuckles. It doesn't itch or hurt, so people usually chalk it up to dirt, friction from clothing, or just genetics. But here's the truth. Acanthosis nigricans is strongly associated with insulin resistance, one of the earliest stages of type 2 diabetes. When your body stops responding properly to insulin, your pancreas pumps out more of it, and that excess insulin stimulates skin cells to grow and produce more pigment. Studies suggest that up to 90% of people with this condition have underlying insulin resistance. So, if you've noticed your skin getting darker in these areas, and scrubbing doesn't make it go away, it's time to pay attention. Another sneaky clue? Itchy, dry skin. Sure, winter weather or harsh soaps can dry out your skin, but when diabetes is the cause, the dryness can be relentless. High blood sugar dehydrates your body by pulling fluid from your tissues, which in turn affects your skin. Poor circulation, another complication of diabetes, reduces the flow of nutrients and oxygen, making your skin weaker and slower to repair itself. This is why even minor cuts, scratches, or bruises may seem to take forever to heal. It's not just inconvenient, it's a sign that your body is struggling. Now let's talk about something called diabetic dermopathy, also known as Shin spots. These are small, round, brownish patches that appear on your shins, often mistaken for age spots or scars. They're caused by changes in the small blood vessels under your skin. Roughly half of people with diabetes experience them at some point, but because they're painless, they're easy to ignore. Think of them as silent alarms, evidence of how diabetes slowly damages blood vessels long before you realize anything is wrong. And then there are skin tags, those tiny, harmless flaps of skin that many people dismiss as nothing more than a cosmetic annoyance. They can be a clue that your insulin levels are higher than they should be. While skin tags are common in the general population, having clusters of them, especially around your neck or underarms, could indicate insulin resistance. When combined with other symptoms, they're another piece of the puzzle pointing toward potential diabetes. One of the more severe conditions linked to diabetes is necrobiosis lipoidica. It starts as small, raised red bumps, usually on the shins, that slowly turn into shiny, thin patches of skin with a yellowish center. Sometimes these patches crack or ulcerate, leading to infections. While rare, necrobiosis lipoidica is almost always connected to diabetes and is a strong sign of blood vessel damage. Speaking of infections, frequent skin infections, particularly fungal infections, are another major warning sign. Yeast infections, athlete's foot, jock itch, or even recurring styes around your eyes thrive in people with elevated blood sugar because sugar acts as fuel for bacteria and fungi. If you notice you're dealing with infections more often than usual, especially ones that come back even after treatment, that's a red flag your blood sugar may be out of control. Another skin-related complication that flies under the radar is digital sclerosis. This condition makes the skin on your fingers, hands, and toes feel tight, thick, and waxy, often making it hard to move your joints. It's caused by changes in collagen linked to prolonged high blood sugar levels. Over time, it can lead to stiffness in your hands and limited mobility, which is why noticing these changes early is so important. The biggest problem is that most people don't connect these seemingly random skin issues to something as serious as diabetes. They assume it's just aging, allergies, or an unlucky skin condition. But diabetes doesn't develop overnight. Research shows that type 2 diabetes can quietly progress for up to a decade before diagnosis, with damage happening in the background. Your skin often acts as an early warning system, giving you time to intervene before full-blown complications set in. Diabetes doesn't just affect blood sugar. It impacts your entire circulatory system, immune response, and even how your skin regenerates. High glucose levels weaken your blood vessels, slow down healing, and compromise your body's natural defense systems. Over time, these effects can lead to nerve damage, kidney disease, and even vision loss. But if you catch it early, if you recognize these signs and get your blood sugar under control, you can dramatically lower your risk of long-term complications. Doctors emphasize that your skin can often be one of the first indicators of metabolic problems. Dermatologists have been known to spot insulin resistance or diabetes in patients simply by examining their skin. In fact, in some cases, people have been diagnosed with diabetes based solely on skin changes, even before blood tests confirmed it. This shows just how important it is to take these subtle symptoms seriously. If you notice any of these warning signs, the best thing you can do is talk to your doctor about getting tested. A simple fasting blood glucose test, HbA1c test, or even an oral glucose tolerance test can confirm if your blood sugar levels are normal or trending toward prediabetes. The sooner you act, the easier it is to reverse or manage the condition. Lifestyle changes like improving your diet, exercising regularly, reducing sugar intake, and maintaining a healthy weight can dramatically improve insulin sensitivity. For many people, catching diabetes early can mean avoiding medication altogether. It's worth noting that not all skin changes automatically mean diabetes, but ignoring these clues is risky. Think of your skin as a health dashboard. Dark patches, slow-healing wounds, recurring infections, or mysterious rashes aren't random. They're messages your body is trying to send you. If you pay attention, you might be able to prevent years of complications down the road. Diabetes is one of the most common chronic conditions in the world, with over 537 million adults living with it globally as of 2021, according to the International Diabetes Federation. The scary part? Nearly half of them don't even know they have it. That's why understanding these early subtle signs could literally save your life. And your skin, being your body's largest organ, is one of the best tools you have to catch it early. Here's the big takeaway. Your body is constantly talking to you. When your skin changes, don't just reach for lotion or ignore it. Look deeper. Check your blood sugar, see a doctor, and listen to what your body is trying to tell you. Prevention starts with awareness, and awareness starts with you noticing these quiet clues. If this video made you look at your skin a little differently, don't keep it to yourself. Share it with family and friends, because someone you love might be walking around with these same warning signs and has no idea. Hit that like button, subscribe, and turn on notifications for more content that empowers you to take control of your health before it's too late. The next time you glance in the mirror, remember, your skin isn't just your reflection, it's your early warning system.